The Influence on Interprofessional Practice and Interprofessional Collaboration in Health Science Students by Economou, Damien Poet, Kaleigh Rapp, Kylie Shore, and Sarah Grier Thompson. Hi, my name is Kaleigh Rapp, and I am a second-year speech-language pathology graduate student at Francis Marion University. Our project is the influence on interprofessional practice and interprofessional collaboration in health science students. My colleagues and I sought out to determine the knowledge and perceptions of students enrolled in health science majors at Francis Marion University on interprofessional practice, IPP, and interprofessional education, IPE, as they are on the rise in many fields, but especially in speech-language pathology. The students' perceptions of interprofessional clinical education, revised instrument version 2, the SPICE R2, was selected and adapted to further understand the perceptions of IPP and IPE across healthcare professions. The survey contained 16 questions, of which 6 were demographic. The other 10 survey questions included, number 1, working with students from different disciplines enhances my education. 2, my role within an interprofessional healthcare team is clearly defined. 3, patient/client satisfaction is improved when care is delivered by an interprofessional team. 4, participating in educational experiences with students from different disciplines enhances my ability to work on an interprofessional team. 5, I have an understanding of the courses taken by and training requirements of other health professionals. 6, healthcare costs are reduced when patients/clients are treated by an interprofessional team. 7, health professional students from different disciplines should be educated to establish collaborative relationships with one another. 8, I understand the roles of other healthcare professionals within an interprofessional team. 9, patient/client-centeredness increases when care is delivered by an interprofessional team. And lastly, 10, during their education, health professional students should be involved in teamwork with students from different disciplines in order to understand their respective roles. It was distributed to 615 students through email with a short description of the research study and the associated Google form. Only 209 students completed and returned the survey. The SPICE R2 required responses to these 10 questions using a Likert scale, with 1 being strongly disagree to 5 being strongly agree. Once data was collected, my colleagues and I implemented qualitative analysis to gauge the participants' prior knowledge of IPP and IPE and measure the participants' interest in learning more about IPP and IPE and health professions. These factors were determined by the data compiled from the modified survey and then analyzed to determine the magnitude of knowledge on IPP and IPE across aspiring healthcare professionals. Figure 2 displays the responses to all 10 questions from the survey in the form of the Likert scale. Upon analyzing the results, we concluded that there were 5 questions that proved to be significant in determining the results of the survey. These reveal that the students in the School of Health Sciences have an overall positive experience with IPP and IPE. The criteria used to determine our results was a percentage of over 90% in combining agree and strongly agree categories. This criterion was shown consistent across questions 3, 7, 9, and 10. Question 6 did not follow the 90% criteria. However, the responses received from participants were overwhelmingly neutral and were classified as significant. Based on these results, participants indicated that service delivery is more efficient when working with a team. Additionally, a majority of student participants indicated that they could identify courses and training of other healthcare professions. Almost half of our participants stated that they thought costs were not always reduced when IPP is implemented. It was found that the students thought IPP should be a requirement in their coursework. The implications of these results show that it is imperative that teamwork opportunities should be created in order to reinforce the learning of IPP and interprofessional collaboration, IPC. We would like to thank Dr. Nia Johnson and Dr. Michelle Norman and our participants for their dedication and participation in our research study. Thank you.